Okay, we're here with Dr. Gallegos, our pain management specialist, and he's going to show us how he picks up injuries with his ultrasound. And we're going to do it on a back, someone who had an injury. And I'll go back and forth and show what you're seeing on the screen too.
Yeah. So with ultrasound, again, we can really look at a lot of structure, especially soft tissue injury.
Soft tissue injury?
Yeah, soft tissue, so like muscle tendons, inflammation in the soft tissue. So cold here. I can explain as we go. So he's having low back pain and it's on the right side, right?
Yeah.
Okay. So right side. So here's the sacrum.
Mm,
Okay.
that's cool.
And then as we go up, that is your sixth lumbar vertebrae. Now, usually when we see a spine injury, we look at a potential issue with a facet, right? Facet it is a small joint between each vertebrae where they articulate or where they have the joint. And so that's the first area we're going to see some arthritis formation.
Okay.
So there's two ways to really evaluate an arthritis area on the facet. If we're going to be doing an injection, the best way is to do it in the coronal plane, because this is a spinous process, meaning that little bone that you can feel when you push around your spine. When you go along, there's a lot of muscles and tendons that kind of attach, as you can see, around that area. And right here is where the facet joint is. So if we're looking at an area of calcification that's suspected, we're expecting to see a really bright white region, which in him is not the case, right? But if we wanted to go deeper into really evaluating a facet, we can go on this view. This is the facet, this is the facet. So again, this is the bottom of the body, so sacrum and the head is going this way. So it would be a lot easier to look at, right, the joint right here, which is a facet joint, either as a true injury or a true area of inflammation or damage. Now, more importantly, we can look at the soft tissue above it, right? Because a lot of people really do have a lot of impingement on the nerves, a lot of impingement or swelling of the soft tissue, which can translate, it can mimic as a true low back or even sciatica-like pain. Doesn't mean that they have sciatica issues, but it just means that they have a lot of inflammation in the soft tissue, that it's literally impinging and causing pressure on those little nerves. And nerves don't like to have pressure. They like to be free, they like to be mobile. So whenever you have any area of inflammation or swelling, the nerves are going to react and they're going to present, they're going to start secreting molecules that we're going to perceive as numbness, tingling, shooting, electric type of pains. So with him, everything looks great. And then we could also look at an area of, or really an area that a lot of people don't really evaluate, which is the SI joint. And that can really mimic and can show as low back pain, but in reality is sacrum in nature. So for him, get a little more gel here. Comfortable?
Yep. Yeah.
So again, painless, right?
Yeah,
The patient
don't feel anything.
doesn't feel anything. They might just feel a little cold with the gel, but generally speaking, they're pretty comfortable. So there we go. So sacrum right here, as it dips down into the SI joint. So the sacrum iliac joint. Now we do see those areas of that really bright white structure.
Calcifications.
Yeah, that could be a little calcification there. The arthritis already forming on that joint. So that would definitely be an area of evaluation or potential causative agent of the pain that the patient is experiencing.
Yeah, I find this fascinating that you can do this ultrasound and pick up injuries. So yes, this is a great diagnostic tool. Once you find the problem, you do different types of treatments.
Right. Really what we look at and what we evaluate here is the potential of a regenerative type of injection, right? And we occasionally also can do a very low level of steroid, which is very rare the times that we do that, but we can do that as well. But really the goal of the treatment is to either improve pain, mobilization, and overall functionality of that area, and really preventative aspect of further. Let's say that somebody has that arthritis is already forming. What can we do now to prevent our arthritis to continue progressing, continue getting worse?
Perfect.
Because that's really what's going to cause or lead to a surgical intervention, right? And so the earlier and the sooner that we can identify already an arthritic inflammatory aspect forming in a joint or in an area, the better outcomes the patient's going to have when it comes to the potential of regenerative medicine, really improving their lifestyle and their overall patient care.
So your treatments, therefore, can prevent surgical injuries,
Absolutely.
surgical procedures.
Yeah.
That's what I love about it, is less invasive.
Yeah. Yeah, less invasive, less downtime. Really, any injection that most patients really spend recovering is about 3 to 4 days. Occasionally we need to do bracing depending on what we're treating, what we're doing. But when you're talking about a surgery is downtimes of even months, right? For example, a shoulder rotator cuff repair, that can take up to 9 months until the patient is really fully recovered. So what kind of lifestyle changes are they going to have to do with their work, with their at-home care, with their children care, because they're literally not going to be able to move that arm for that long, right?
So income.
Exactly. Yeah. So when you take everything into perspective, regenerative medicine is a phenomenal tool and phenomenal treatment for a lot of patients.
Right. Well, thank you so much. This was very educational for us. We can't wait to share it with our patients.
Yeah. Thank you.